Hello, everyone. Welcome to the Briotix Health Spotlight, where we speak with providers, subject matter experts, and other key stakeholders in the field about the various aspects of worker wellness that are affecting you and your company today. We are joined today by Team Supervisor from Briotix Health, Heather White. DEI, diversity, equity, and inclusion may sound like a corporate buzzword or extra cost to some. At Briotix Health, we know that it is an essential tool to provide employees the care they need every day. As the lead of our DEIB, or Diversity, Equity, Inclusion, and Belonging Committee here at Briotix Health, Heather has a unique perspective on where DEIB enters the workplace and the necessity of these programs to create a workplace and work life that lets employees succeed, free from injury and discomfort. Heather, thank you so much for joining us today on the Spotlight. I wanted to bring you on today to discuss a little bit more about DEIB, Diversity, Equity, Inclusion, and Belonging, as we say at Briotix Health. But before we get into that discussion, can you tell us a little bit more about yourself? What's your background? How did you start working at Briotix? And what's your involvement with DEIB here at Briotix Health?
Yeah, great. So I'm Heather White. I am the committee lead for our DEIB committee, and I am also a team supervisor here at Briotix. I am an athletic trainer by trade, and so providing care and making sure that every space or sport is accessible to those who are incorporating in it and engaging in it are available and they have the access to do so. And I want to make sure that that is shared kind of across the space. I am also the accessibility committee chair lead for our South Carolina Athletic Trainers Association. So I do take this very much close to heart and making sure that everyone has equal access and an equitable access to that and being as inclusive as possible. So yeah, I've been with Briotix for a little over 2 years now and have loved every minute.
Wonderful. So when we're talking about ergonomics in the workplace, DEIB is not something that people often put to the forefront of their mind. DEI, as most other companies call it, diversity, equity, and inclusion. And when a workplace first implements an ergonomics program, what factors of that traditional understanding of diversity, equity, and inclusion are included already?
Yeah, I love this question because people rarely connect ergonomics and DEI at first glance, but they are deeply connected. When most organizations launch an ergonomics program, they think about equipment and injury prevention. From a DEIB lens, I look at access, voice, and design. Equity shows up in who receives the support. Do the assessments reach frontline staff, remote workers, and shift employees, or does support stay concentrated at the top? Inclusion shows up in how solutions get designed. Different body sizes and heights require different setups. A standard setup does not fit a 6'4" employee and a 5'1" employee the same way. Age, job type, pregnancy, disability, and chronic conditions change physical needs. And something that's a little bit newer to the discussion is neurodiversity and how that influences lighting, noise, and workspace layout. Traditional DEI often focuses on representation and policy. Ergonomics bring DEI into the physical space. It asks, does this environment work for you? If your employee cannot sit, stand, or reach safely, productivity conversations mean nothing. Belonging shows up in the psychological safety. Employees feel safe reporting discomforts early. No one fears being labeled as high maintenance, and leaders respond with action, not skepticism.
I think, focusing on, these are actionable things that people can see in the workplace. These are the difference in height, I think, is such a good example here of someone who's 6'4" is not going to be able to reach the same things a person who is 5'1" can comfortably. I mean, just these simple ways of showcasing that diversity, equity, and inclusion are constantly being considered constantly around us, and they are a integral part of these programs that we're putting out in the world, and understanding that getting more talent on board, more people accessible to your workplace is only ever positive. And employers may see these measures as an additional step beyond a standard program when they're first introduced or described. With an emphasis on cost savings and productivity increases, what is the value of including these considerations in programs with that in mind?
Sure. Yeah. And that's a conversation that we see a lot. So some leaders see equity considerations as extra layers and extra steps, but in reality, they protect performance and reduce risk. Musculoskeletal disorders remain one of the leading drivers of workplace injury claims in the US. They account for a significant portion of workers' compensation costs and lost workdays. When you build ergonomics with an equity lens, you prevent injuries earlier, you reduce absenteeism, you improve focus because people are not working through pain, and you lower turnover tied to chronic discomfort. Pain impacts cognitive performance as well. Discomfort reduces engagement. If your employees are physically strained, productivity suffers whether you measure it or not. DEI in ergonomics is not a social add-on. It's a risk management. It's a performance strategy, and it's cost containment with humanity at the center. So the value is simple: fewer claims, stronger retention, higher performance. And you can achieve that while reinforcing the trust that is imperative with retention.
Yeah, and just to give some additional perspective on that, the matter of musculoskeletal cases there, the National Safety Council last year reported that from 2023 to 2024, the number of musculoskeletal non-fatal injuries and illnesses reported that were DART cases and days away from work cases were respectively 937,000 and 484,000. So this is not just some minor thing that employers see on the side. This is a major element of running any business, is considering these implications and the ways we can reduce them, and considering DEIB, considering the way that your workers are operating in the workplace is essential to that. DEI from the employer is valuable, but Briotix Health as a provider also implements DEI, or DEIB, as we say here, in our programs intrinsically. Could you give your perspective on what that looks like day to day as a leader of DEIB in the company?
So for us, especially for Briotix, the belonging portion of that is really what matters, and making sure that you are feeling as much belonging as you can within your company and where you're working. So for us, DEIB is not just a talking point. It actually shapes all of our daily decisions. Day to day, that means that we will start with listening before prescribing solutions. We ask open-ended questions about comfort, routines, and barriers, both at work and outside of work. And we avoid assumptions based on a job title or physical appearance. We offer equipment options across price ranges to help prevent inequity between departments. We tailor communication to match cultural context and learning style, and we provide accessible materials when needed. And as I said, belonging shows up in consistency. A warehouse employee receives the same level of attention as a senior executive. A remote employee is going to receive equal access to evaluation and follow-up. A returning employee receives support without the stigma. And we design around the individual, not just the task. The daily consistency helps to build trust. Trust increases participation, and participation improves outcomes.
And an enormous amount of value can come from the addition of these practices in any program for both employees and employers. Beyond just the workplace practices on the job, what are other benefits of considering that implementation of DEI or DEIB programs in the workplace?
Absolutely. The impact extends well beyond the workstation. When candidates see that your organization invests in inclusive safety programs, it signals long-term commitment. Candidates with disabilities, chronic conditions, or caregiving responsibilities pay attention to that. Inclusive practices widen your talent pool. DEI or DEIB informed ergonomics support individualized recovery plans. Instead of a rigid timeline, you create adaptive pathways. That reduces re-injury and improves long-term retention. Employees feel supported, not rushed. Employees who feel physically and psychologically supported stay longer. Retention strengthens your internal pipeline. You build future leaders who trust the organization because they experience care firsthand. And there's also a broader benefit. When employees feel seen and supported in one program, they are more likely to engage in others. Wellness initiatives, training, feedback processes, trust compounds. DEI is not an add-on to ergonomics. It is the foundation that makes ergonomics effective. If you design for the average, you exclude many. If you design for a difference, you improve outcomes for all. That is the real opportunity. We move from compliance to care, from uniform solutions to adaptive design, from short-term savings to long-term sustainability. And when you build that way, you do more than prevent injuries. You build a workplace where people can thrive.
So in our conversation today, I feel like a lot of the benefits of DEI, DEIB that we've seen are taking these programs a step beyond just the absolute minimum of care. And I feel like that's something that really resonates a lot through a lot of the practices that Briotix Health preaches and that we put out in the world that our providers bring to the workplace every day. Personally, I write a lot about building cultures of safety in the workplace, and I feel like DEI is a really essential part of that, of, letting people know that there is more than just the workplace. There's the life beyond the workplace. And as Briotix Health providers, what we are trying to provide is the best life beyond and within the workplace for care, for prevention, for giving you the tools to live your best life. In your time working with Briotix Health, have you seen anything like that, whether from providers on your own? Have you had stories that you would like to share of just that success beyond the workplace that has come from some of these initiatives that we put in place?
Absolutely. I think one of the most kind of poignant pieces to that is how we're creating our current client materials. Are we taking into account, various accessibility features that are available when we do Teams meetings or when we create websites? Are we making sure that it is accessible to everyone? Those who are neurodiverse, those who have visual impairments, those who may require specific accessibility features enabled for them, closed captioning for one, having an open transcript for two. There's a multitude of things that we've done recently that have helped to improve that, and we've seen a lot of feedback and heard a lot of feedback on how beneficial that's been. When you are in client meetings, and there's a lot of numbers and facts and key points being put around, and you're not able to keep notes as quickly as possible, you can pull up that transcript and that's going to be right there available to you. It has helped improve communication and understanding across the board. So that's definitely some of the things that we've seen just offhand. And having that sense of belonging and building that cultural foundation that it matters and that you matter and you're so much more than just your job, I think has really helped to add to that and just continue to build and grow within this company.
Where do you see the next step for DEIB at Briotix being? Is it more implementations in the workplace? Is it more of these adaptive tools?
Yeah, great question. I honestly think that the sky is the limit on that. I think it is, as our society becomes, more aware of what's available out there, it's just going to continue to grow. And we can emphasize our resources and our capabilities as a company to add in that extra level of care into our services that we're already providing on site, and helping to just expand on that. So really, I think the only limitation you have is what you put on yourself. So, as long as we keep moving forward, and following with the upcoming trends and new research that's going on, I think that's really where our success lies.
Heather, thank you so much for giving us more of your perspective on DEIB in the workplace, where it's going in the future, and what it looks like right now at Briotix Health. If you'd like to learn more about Briotix Health, please check us out at our website, briotix.com. You can email us at info@briotix. And Heather, thank you so much for joining us. And it was a pleasure to talk to you.
Thanks for having me.